Hello, I am李Ryong, an associate professor at the Department of Oral and Maxillofacial University
Surgery.
Hospital. Nice to meet you. Today, I would like to talk to you about the topic of beautifully shortening a long face. This case involves a superior movement
And a
of 5
rotation of
mm.
3
The rotation
mm
mentioned
refers
to a clockwise rotation.
I have prepared a case
where the posterior movement is 1.5 to reduce
mm.
the length of the face, making it look significantly prettier. Today, I would like to explain
the length of this face,
what the criteria are, and how the surgery is performed. The patient is a 25-year-old who underwent square jaw surgery in 2016 and cheekbone reduction and chin surgery in 2019. She wanted to reduce the length of her face significantly. She complained her jawline looks wide. She wanted to narrow the width of her face. She came with the desire to reduce your right cheekbone. Those are something that most patients wish for. I perform quite specialized revision surgeries. I usually talk about how to effectively lengthen the face, how to widen the face, how to broaden the jaw, and how to expand the cheekbones. Today, I am very happy to be able to share with you how to beautifully shorten the length of the face. So everyone, I have prepared well for you today. I think it would be good for you to understand and apply the criteria I use when reducing face length in the future. Please watch the video until the end, and don't forget to like and subscribe. Since this person is not undergoing reconstruction, T1, I will not use the timings. This is the CT from when she came to see me. The facial contouring was already done, and the cheekbone surgery was also performed. It wasn't a double jaw surgery, and you can see that the right cheekbone is slightly protruding. The patient also mentioned that they would like to have the right cheekbone filled. So I told the patient that this will be confirmed. We decided to proceed with the reduction
on the right
surgery. Cheekbone. The most important thing is that the patient... I need to empathize with each other first, and we need to look in the same direction. In order to plan the surgery accurately, if what the patient says aligns with the CT or clinical findings, I will empathize with that, and I believe we can discuss how to improve it together. The most important thing is empathy. I believe empathy is the most important. As you can see here, the right cheekbone is clearly more prominent than the left. So I decided that this could be reduced and plan to only enhance one side's cheekbone. And if you look at the cephalogram, which we usually take the most, the occlusion is class 2, which means it's an underbite and has excessive overbite. And upon closer inspection, there is a slight asymmetry. Left side protruding, but overall, no asymmetry such as the inclination of the occlusal plane is observed. And since the upper teeth are somewhat exposed compared to the lips, we can reduce the length of the face to some extent. I made that judgment. And the patient mentioned that they would reduce the length of their face sufficiently and are considering a philtrum reduction surgery. However, I believe that aiming to reduce it to needing philtrum reduction surgery is not appropriate. So, I thought about how to make this face look the most beautiful, rather than just drastically reducing it to fit the facial proportions. As you can see when you look at my face, it's not bad. I think it's a pretty face. However, the mid-face is long like this. The mid-face is long, and while the lower face doesn't feel that long. It looks long because the mid-face is long. And there's one thing you all need to keep in mind. In my opinion, it's not that the original occlusion. According to the original occlusion, it would fit in like this. But it seems that the mouth is slightly protruded. When I talk about the various ratios I use when shortening the length of the face or performing orthognathic surgery, I actually use more criteria than what I show, but I will briefly mention a few important ones. Typically, the starting point of the hairline known so far is the glabella, which is the point between the eyebrows. The subnasal is below the nose, and the stomion is between the lips. When I draw here, it should be 1 to 1 to 1. The lower jaw should be from here to here, which is 1. From here to here is 2, so it's 1 to 2. That's why we are using this a lot. So I measured it again. Upon measuring again, it came out to 1 to 1.033 to 1.169. It was clearly diagnosed that the jawline is long. But the problem with this is that the middle part we usually talk about is not this part, but from the pupils to the lip line. So I will talk about that again a bit later. And if you look at the Ricketts E line that I usually use, when you draw a line from the tip of the nose to the tip of the chin, the upper lip should be about 4 millimeters, but here in the lower lip, you can see that the upper lip is almost folded, and the lower lip is also folded. It's okay. It's okay like this. But the reason I drew this is that I wanted to know that there is no need to advance the maxilla. And I realized that a slight backward movement is also possible. And the jaw. Oh, if they were originally about 2 mm in, but here they are almost touching. However, what I conclude is that there is no need for a reverse rotation, and there is no need to push the jaw forward. I am using the Ricketts E line to establish such criteria, and the standard I mainly use is the golden ratio. I have shown this before, but I believe this expresses the ratio between the midface and the lower face much more appropriately. So this is the ratio of the distance from the pupil to the lip line, and from the lip line to the tip of the chin. However, this needs to be tilted slightly. In the usual facial position we use, when measured with the tilt, the ratio came out to be 11.678, since the golden ratio is 11.618. What does this mean? It means that the middle is long. In this case, in order to achieve the golden ratio, you can either elongate the chin or shorten the midface. Since this person's face was overall long, it was obvious that we needed to plan to shorten the midface. And I measured the ratios of the patients I showed you last time, and they were 1 to 1.49 and 1 to 1.57, which were significantly shorter in the midface compared to the golden ratio. So the proportions of the face that we usually talk about have been completely destroyed. I think such expressions can be used in situations like this. These individuals are mostly patients who had their mid-facial area elongated to achieve that golden ratio. And the earlier measurement was taken from a photo of the face. Since we need to measure from a CT scan to actually reduce the length, we measured according to the golden ratio, and the distance from the top of the eyes to the lip line was 66.17, and from the lip line to the tip of the chin was 39.51. So if we measure this ratio, it comes out to 1 to 1.65, which is very similar to the 1 to 1.678 I measured in the earlier photo. But if you take a closer look, I had planned to rotate the occlusal surface clockwise a bit. When the jaw rotates, if it decreases by about 2 mm, then this 39.51 will eventually become 37.51. However, since this 37.51 and the length of the mid-face should be 1 to 1.618, multiplying the two gives us 60.70. If this length, which was originally 66.17, becomes 60.70, so right now the golden ratio is 66.17, and since we want to match the golden ratio of 60-70, if we calculate this, it goes up by about 547 mm, we can achieve that ratio. And we concluded that it would match the golden ratio. However, it's not just about this calculation. We also need to consider the patient's lip, meaning we have to think about the overall exposure of the maxilla. So we planned for 5 mm instead of 547. So we decided to raise the maxilla by 5 mm and to match the previously shown, and to reduce the overall facial length by rotating 3 mm clockwise. We planned a clockwise rotation. And if we raise the maxilla and rotate clockwise, in other words, if we rotate in the forward direction, the biggest issue could be a monkey mouth. To prevent the monkey mouth, we plan to move the maxilla back by about 1.5 mm. Digital planning was done according to those figures. I perform digital planning in all cases, and I analyze everything in 3D. Someone asked in the comments who does 3D analysis. However, this method is not new. It's something I've been using for about 20 years since my training. Of course, the methods have become more refined, and various better technologies have emerged, making it easier for me to use. But this method is originally very old. I elevated the maxilla and performed a rotation. And here we have planned to raise the maxilla and mandible upwards like this, shortening the length of the face, the mid-face, and the jawline together. Now, let's take a look at before and after the surgery. If you look at it in 2D before and after the surgery, you can see that both the maxilla and mandible have been going up, right? And you can see that a rotation has occurred. And here, what I hope you all pay attention to is the upper lip. The straight drop of the upper lip. Without this curvature is referred to as a monkey's mouth. A monkey's mouth can occur when there is a lot of rotation. However, since a proper backward movement was made, it is observed that the lip line is maintained. After the surgery, it is observed that the difference between the upper and lower lips is not significant, and the length of the face has appropriately decreased. Now, let's take a look in 3D. In the 3D view, the occlusal discrepancy that was present has improved. The occlusal discrepancy has improved. The length of the face has decreased. And there has been a rotation. The maxilla has moved upward. And if you look at the front view, the cheekbone has been reduced and the bone has not been touched. The right cheekbone has been reduced overall. And I trimmed the slightly protruding part on the left to ensure symmetry. Also, simply rotating the upper and lower jaws clockwise makes the jaw look blunt. So I advanced it slightly along the existing bone, cutting line by about 2.5 mm. Now, if you look at the soft tissue, you can see that the length of the face has decreased. Here you can observe that the midface has also shrunk, and the nose has widened a bit, which is a bit disappointing, but I think it hasn't widened too much. And if you look at the side view, it looks like this, and the chin has gone back, making the face shorter. If you look at it at a 45-degree angle, you can see that the chin has indeed gone back. So I think this lip might look a bit unnatural, but I will show you the before and after changes with facial photos. Here are the before and after comparison. It might seem like there is an overall image change, but in reality, there has been a considerable change, and the mid-face, which used to feel long, has become shorter. This person doesn't think that the mid-face is very recessed, so they didn't enhance the mid-face, but still, making this area has lifted and rotated. And this part, especially when reducing the length of the face, the area that I think should be reduced the most is this part next to the nose. The length of this area has decreased, creating a nice curve. And if you look at the side profile, you can see that I did not undergo any jaw contouring surgery during this procedure, so my jawline has been maintained. The feeling of my jaw protruding has improved. I also compared the proportions of the midface and jaw. The proportions are as follows. Before the surgery, the ratio was 1 to 1.678. But after the surgery, it became 1 to 1.623. Since the golden ratio is 1 to 1.618, I think the facial proportions are much closer to the golden ratio after the surgery than before. And this photo was taken at the hospital, and the patient was so pleased with the results that they sent me a video. So I captured a screenshot. By applying lipstick like this, it seems to create a much more, how should I put it, beautiful image. And how should I say it? If my face looked like this before the surgery, I don't think such an image could ever come out. The good news is that, since there is still some tooth exposure after the surgery, I am not currently considering a philtrum reduction. To summarize, I talked about how I can effectively reduce the length of my face while adjusting the proportions to the golden ratio. The method I use involves applying the golden ratio to maintain a consistent ratio of 1 between the mid-face and the lower face, and whether to rotate or not. To determine whether to rotate or reverse rotate, I use the Likert E line. And of course, I also consider the Barcelona line. Additionally, when rotating, I incorporate a slight backward movement of the maxilla to avoid creating a monkey face. Following this principle, to reduce the length of the face. Thank you for listening today as well. And I will make sure to provide content that will help you when you decide on surgery or plan your surgery next time. Thank you for your attention.